Hello and welcome to the National Coalition for LGBT Health webinar on the impact of COVID-19 on the LGBTQ+ community. Thank you for joining us. My name is Elena Perry. I'm a project associate working on the coalition. Please note this webinar will be recorded, and if you have any questions throughout the webinar, submit them using the Q&A box, and they will be directed to our speakers at the end of the presentation. I'll now turn it over to Michael Schenkel.
Thanks, Elena. Good afternoon, everyone. I'm Michael Schenkel, Director of Education and Advocacy with the National Coalition for LGBT Health. We certainly are living through an unprecedented time in public health response to the COVID-19 pandemic. Our lives and the way that we interact have changed dramatically over the last several weeks, including the way services are being provided to our community. During this National LGBT Health Awareness Week, we want to highlight some of the efforts of LGBT community groups and health centers as they support the LGBTQ community during this crisis. I want to also thank you for your participation in this webinar, and for those of you who are on the front lines of providing care and services, thank you so much for your service. I just also wanted to introduce some of our other National Coalition members who are on the phone today. You heard from Elena Perry, who will be our moderator and producer of today's webinar. She's a project associate with us, and you will soon hear from Neil Modi Bailey, who will talk about today's lineup with you. Just as some background for some of you who do not know, the National Coalition has been in existence for almost 2 decades now, and we are committed to improving the health and well-being of lesbian, gay, bisexual, transgender, and queer plus individuals through advocacy, education, and research. Some of our current coalition activities include LGBTQ plus health advocacy briefs, which are designed to educate members of the coalition, LGBTQ plus community, providers, and legislators on pressing health policy issues impacting the LGBTQ community. If you're not on our mailing list, please email Elena at healthlgbt.org, and we can get you signed up on that list. We also distribute action alerts to our network to encourage members to call and write representatives or participate in sign-on letters, comment periods, or amicus briefs on urgent health policy issues. The coalition also runs a co-pays count campaign to ensure that manufacturer coupons and copay cards that are used at the pharmacy counter go toward meeting an individual's deductible when using their insurance plans. We are getting ready to launch our next State of LGBT Health national survey. And over the summer, we will be launching a reaccredited LGBT health training and certificate program that provides professional development services for clinicians and other health professionals to enhance knowledge and delivery of culturally competent care. The coalition has produced and will be producing over the next several months several webinars and trainings, and we will be holding a national virtual conference, Sync 2020, which will be announced shortly. This was originally scheduled for an in-person conference that was going to be happening in May, but it will now be a virtual conference due to the pandemic. This is National LGBT Health Awareness Week. It's the 18th annual Awareness Week that was created by the Coalition for LGBT Health. This year's theme is entitled Turn Out for LGBT Health, and the goal is to turn out for health through voter engagement and health advocacy issues. The week is designed to raise awareness and education of LGBT health disparities affecting the LGBTQ plus communities and increase education for health professionals. You can visit our website, healthlgbt.org, to access a promotional toolkit as well. I'm going to turn it over to Neil, who will go through some learning objectives for today.
Hi, everyone, and thank you for that introduction, Michael. My name is Neil Modi-Bailey. I'm the LGBT Health Associate with the National Coalition for LGBT Health. I'll be talking with you about the learning objectives for this webinar. So we will highlight the COVID-19 response of the LGBTQ plus community groups and health centers as they support LGBTQ plus communities through this crisis. Explore unique issues affecting LGBTQ plus communities related to COVID-19 pandemic. Discuss how traditional programming and services have been modified to meet community needs. Discuss innovative practices being implemented by the LGBTQ plus community groups and health centers in response to the emerging needs of the LGBT plus communities. Identify legislative and regulatory processes that may impact access to services or programs for LGBTQ plus individuals. Now we will go over a little overview of COVID-19. So COVID-19 is a respiratory illness or a respiratory virus that is mainly spread from person to person via close proximity, typically less than 6 feet, through respiratory droplets produced from an infected person's cough and or sneezes. The World Health Organization declared COVID-19 a pandemic on March 11th. Older adults and people of any age with underlying medical conditions, including but not limited to chronic lung disease or moderate to severe asthma, people with serious heart conditions, and immunocompromised individuals. Many things can cause a person to be immunocompromised, such as cancer treatment, bone marrow or organ transplantation, immune deficiencies, and poorly controlled HIV or AIDS. As of March 25th, the CDC reports a total of 54,454 cases and 737 deaths in the United States. Now, this number is constantly changing and is projected to increase in the upcoming weeks. Now, I'm going to pass over the mic to Elena, who will walk you through the topics that will be presented in this webinar and the presenters presenting them.
Thank you, Neil. We will first have Anthony Fortenberry, the Chief Nursing Officer, and Kimberly Smith, the Senior Director of Community Health and Family Planning at Callen-Lorde from New York, presenting on a clinical perspective on COVID-19 and the LGBTQ community. Then Debbie Ojeda-Leitner, a policy advocate at NCTE, will present on COVID-19, what trans people should know. Quentin Bell at Nights and Orchids at Orchids Society in Selma, Alabama, will present a community spotlight on a TNGC client-centered approach. Then Tyler Tamir, CEO of Cascade AIDS Project in Portland, will have a community spotlight entitled Returning to the Roots of Our Movement. Erin Tax, the Director of Advocacy at SAGE in New York, will provide a community spotlight on older people. Then Elizabeth Wigling at Elizabeth Cooney Care Network in Towson will provide a community spotlight on elderly care and social isolation. Our final two speakers are Dylan Wagesbeck, the Public Policy and External Affairs Director at True Colors Fund, will present on COVID-19 and LGBTQ youth homelessness. Julie Cruza, the Director of Federal Policy at Family Equality, will present on COVID-19 and LGBTQ plus families. Before I hand it over, just a note that audio is lagging for some, and we will send out a recorded version of this webinar at the end. Without further ado, Anthony, you can take it away.
Great. Hi, thank you for having us. This is Kimberly Smith. I'm the Senior Director for Community Health Planning and Policy at Callen-Lorde Community Health Center. Can folks hear me? Hopefully, yes. I use she and her pronouns.
Hi, good afternoon. My name is Anthony Fortenberry. I'm Chief Nursing Officer at Callen-Lorde Community Health Center. I use he and him, and thank you so much for having us today. Where you have a few slides, and I'm going to very quickly kind of go over what our response to COVID has been at Callen-Lorde. And at the end, we will have our contact information that you can reach out to us directly if you have any specific questions. Just a quick overview of our health center. Callen-Lorde has started as a volunteer-based health program serving LGBTQ plus New Yorkers over 50 years ago. Since then, we've evolved into a federally qualified health center serving almost 20,000 people in 3 clinical locations across the city. And we have a brand new site opening in Brooklyn later this year. Of the 20,000 patients we serve, about 5,000 are living with HIV, and almost 1/3 are transgender or gender non-binary. As such, we have a pretty robust support program related to both HIV and TGNB services. Our response to this crisis has really been focused on trying to maintain those support services for our most vulnerable patients. We've really pushed toward telephonic and telehealth services. We started with our behavioral health and psychiatry programming, and they've also now evolved to be able to provide both online and telephonic support groups for those patients. Our goal essentially is to stay open for as long as possible and really maximize keeping both our patients and our clinicians and staff outside of the center as much as possible. And so what we have kept on site is a limited schedule of 9 a.m. to 3 p.m. We have a triage nurse, limited medical providers, and support staff, primarily to ensure that we can maintain access to pharmacy. We are seeing a lot of patients concerned about access to ARVs, as an example. And so we have pushed to try to have most of our patients access delivery. We've made pharmacy delivery free of charge, and Medicaid managed care plans are also now allowing us to do 90-day supplies of most medications. And so we've really tried to maximize that messaging to patients, as well as ensuring we get those deliveries out so that patients don't have to come into the clinic. What we are seeing is a lot of patients are, the ones that are coming into the clinic are either symptomatic, and they are being evaluated by a clinician and either provided with home care guidance or referred to the ER as necessary. A lot of the other needs that are coming in are some urgent care that's not respiratory, but for the most part, we are seeing that our patients are staying home. Our telephone triage that we have in place generally would see anywhere from 50 to 75 calls a day. We had almost 400 calls on average this week, and so we are seeing a lot of telephonic triage happening. We have our medical providers to help support our registered nurses in addressing those phone calls in a timely manner. And so that's also a service that has really moved to a more telephonic model. Something else that I wanted to be sure to mention is occupational health. We find that most of our staff are of the community that we serve, and they have the same needs. And so we've created a temporary occupational health program just for our staff so that they were able to access clinical advice and things like hormone injections and other healthcare needs that they may not be able to get access to as they normally would. And so ensuring that our staff are taken care of has been another important strategy for us. We are limiting the number of staff that we have on site by doing a rotation. So as an example, our registered nurses are each coming in 1 day a week to try to limit travel to and from the center. Another strategy that I think has been very successful so far is we've started a Zoom meeting schedule for staff. So staff have the opportunity to log into Zoom and see their colleagues on a routine basis for things like yoga and guided meditation that are providing some emotional support during this difficult time. All right. Thank you.
Hi. So I'm going to talk just a bit about some of the policy and advocacy issues we are facing since the onset of the COVID pandemic. Really, we had to pivot very quickly. We were rolling along in what was maybe not quite a typical, but mostly typical state budget and legislative session. Our New York State budget needs to be signed and put in place by April 1st. So we were working hard on those issues as well as legislative issues when the COVID pandemic hit, and had to quickly pivot given some of the changes in the clinical operations that Anthony just spoke about. One of the first things we had to do was really work with our statewide primary care health association and do some very strong lobbying to get guidance from the state Department of Health and regulators on billing and reimbursement. Patient revenue is a big part of how we operate, and given that we had to really kind of scale down our access to the clinic for patients and just kind of maintain an urgent care setting and do transition to telehealth and telephonic visits, this really impacted our revenue. And in addition, there wasn't, the guidance wasn't fully in place in terms of how we were going to be reimbursed or how we would bill for those services. So that is happening kind of real time. We are receiving, I think the last guidance that came out was Monday, but they are updated regularly, and we are continuing to work with the state and our primary health care association to try to make sure we can bill as much money as possible to be able to stay afloat, since our patient visits dramatically, at least in person, dramatically reduced. Another thing is that we had to pay attention to is we were, as I mentioned, already kind of in progress in terms of, advocating for a state budget that would support people living with HIV and LGBTQ health issues. And in New York State, one of the issues that we've been working on is is a redesign of Medicaid, as the way our governor would put it. He's attempting to save $2.5 billion in the Medicaid program. And so we were already kind of working on that, and this sort of has added an extra layer to some of the proposals that would not be great for our community health centers. We're also, fighting really hard on the federal level. There was an initial, for funding specifically for community health centers, there was an initial flow of about $100 million for community health centers, which is great, and we thanked our Congress folks for that. Unfortunately, that amounts for Callen-Lorde, once it's divided up, to about $52,000, which is certainly not nothing, but it's definitely not enough. Apparently, there's another $1.3 billion that will be included for community health centers in the stimulus package. Again, we're very thankful for that, but as we are, seeing dramatic reductions in patient visits, I think we're going to need a lot more, so we'll be advocating very aggressively on that front. And then one thing I wanted to mention is just kind of the activism and advocacy that has sort of sprung up out of this. There's, in particular, in New York State, there's a group called the COVID-19 Working Group that really kind of emerged almost immediately before it was deemed a global pandemic. From HIV, a lot of HIV activists and advocates and people living with HIV, but now it's grown much beyond that. And even though we're not able to meet in person, somebody put together a Slack channel, and we've broken up into subgroups, vulnerable populations being one, testing and diagnostics being another. And so we've been kind of communicating via the Slack channel and sharing information, sharing articles, sharing data, sending, circulating various sign-ons, and kind of helping one another, supporting one another in our own individual advocacy, and kind of coming up with a more comprehensive plan. And so that's been very inspiring and somewhat just really kind of beautiful to see and be a part of. So I think I will end there. Thank you.
We have our contact information there. Thank you so much.
Thank you, Anthony and Kimberly. Now we're going to hand it over to Debbie Ojeda-Leitner.
Hi, everyone. I hope you can hear me. This is Debbie from NCTE, National Center for Trans Equality. I want to thank you for taking the time away from other remote work, Netflix, or Animal Crossing to be here with us. Just a little bit about NCTE in general before we start. We're an organization that started in 2003, my notes are kind of off. We're an organization that started in 2003, and we've been around advocating on the policy level, federal, state. We've also worked with service providers, and we're also really proud of our survey that was published in 2015, the United States Trans Survey, which is the largest national survey for trans people. If you haven't read it, I suggest you check it out, but that's where we get most of our data. So I wanted to start with the unique challenges that we find within our community. I don't know what's going on with the notes. So we have really high risk of tobacco use. We have high rates of HIV and cancer rates among the trans community, which is very concerning, which is why the virus is really concerning for us. According to the NCT survey, trans people are 5 times more likely to be living with HIV compared to the general population. And we, as the LGBTQ community as a whole, we tend to use tobacco at a rate of 50% higher than the general population. So this virus is, since it's a respiratory illness, this could be especially harmful for smokers. I think the other thing to think about is that more than 1 out of 5 transgender adults have at least one or more chronic conditions such as diabetes, arthritis, and asthma. And so this pandemic is particularly it's going to negatively impact our community a lot. Another thing to also consider is the barriers to healthcare. As a lot of you probably know, fear of discrimination keeps many of us from going to the doctor, and so this may have an impact on the virus may have a potential impact on us due to stigma and discrimination, which makes trans people more reluctant to get help. And also we have to be aware of other access to healthcare, such as lack of insurance, which leaves us less likely to get medical care. And so existing health conditions mean more of us live in a state of compromised health. Some best practices that we suggest. Let me see if my notes are good here. Weird. Okay. I apologize. For some reason, the notes in this got a little bit off. We've been telling our community to create a plan of action. So talk to your family members and roommates or the people you interact with daily about what to do in case of an outbreak in your community. That means identifying who are the most vulnerable people, which generally tends to be older people, people with disabilities, smokers, and those with compromised immune systems that are most prone to the virus. Identify specific rooms that you can self-quarantine, and make sure you have an emergency contact list. Of course, practice good hygiene. I'm sure you've been told so many times now to wash your hands. Think about what to do when you're sick or you have a contact with somebody who's sick. Please do not go to a healthcare center or healthcare services without calling ahead, because there's going to be protocols in place to ensure that nobody else gets contracted by the virus. And some of the symptoms can include fever, coughing, shortness of breath, as you probably know. The other thing I wanted to highlight is that we hope trans people consider preparing an emergency home quarantine kit. It's okay to stockpile, of course, try not to hoard, but in case of an outbreak in community, you make sure you have a 14-day supply of daily items, and that's specifically for the trans community. That includes, sufficient supply of hormones and syringes, vaginal dilators and other medical items, specific grooming or beauty items like razors, makeup, wig, binders, packing equipment, etc. And just one clear note, chest binding does not increase one's odds of getting the virus, but if you do have respiratory illness, do not wear a binder so tight it reduces chest capacity. And we actually have a link to some more guidelines on that on our COVID-19 guide that I will share out later. Another thing also to recognize, this is from the LGBT National Cancer Network. They also recommend checking out if you feel like you've been contacted by the virus, that if you can't, there's some reports that if you can't smell something, you probably have, that's a symptom of the virus, so there's something to look out for. This is passing by quickly. Another thing I wanted to point out is that there's been a lot of reports of the trans community saying that their surgeries are postponed, and I wanted to make a clear message here that elective does not mean not necessary. It just means not emergency. So this isn't a judgment about our community specifically or the care that we need, and this is the one time hospitals appear to be treating trans people like everyone else. The point is that nobody wants to be in a hospital now if they don't absolutely have to be there, and we're safer just to stay at home. However, we know that it's a blow. Trans people have to fight harder to get the care that we need. And, of course, there's a lot of concerns about more barriers with rescheduling. And we recognize the pain many are feeling at waiting more months for necessary surgeries, and that, it's real. So we encourage folks to reach out for support. Please take care of yourself and each other, and we'll keep fighting to make sure everyone gets the care that they need. And then also, I just wanted to point out some few policy updates. We've been advocating for healthcare, housing, criminal justice, immigration justice, and more explicit resources. More explicit policies on non-discrimination, especially for gender identity and sexual orientation. And last night, the Senate did pass a CARE bill, which is the phase 3 bill that helps millions of Americans keep food on the table, get care if they need it, and then slow the pandemic. But we know that this is not enough. For example, it doesn't help the millions of immigrant families, or to slow the spread in the world's largest prison system, or fix huge gaps in paid leave. And just a reminder that trans people are more likely to be in low-wage jobs. They're likely to be homeless, incarcerated, and living with disabilities, which puts us all at more at risk. Congress, we're hoping that Congress can return to the table and protect everyone. And it's just a reminder that the virus doesn't care about immigration status or state lines or prison gates. And then the other focus that we have also is that, I don't know if anybody's been following what's going on in Idaho, but they might be the first state to pass a bill that bans trans youth from sports. And we find it a little ridiculous that they are more focused on that than the current healthcare crisis. So we're definitely looking for people who can volunteer to call and reach out to residents of Idaho to urge the governor to veto HB 500. And if you wanted more information on that, please let me know. I do have my email on this PowerPoint. But we're hoping that politicians will focus less on attacks on the trans community and more on this current healthcare pandemic. And I think that's all I have. Please, I encourage you to look at our COVID-19 guidelines. We are updating it every single day with new resources that we're getting. And so please pass this to your patients, to the members of your community. We've been getting a lot of traction by it. We've been getting very positive feedback. You all have now my email. So if you have a resource that we miss out, or if you have any questions, please feel free to reach out. I'm happy to help as best as I can. And I think that's all I have for y'all.
Thank you so much, Debbie. Next is Quentin Bell from the Knights and Orchids Society in Selma, Alabama.
Hey, good afternoon, everybody. My name is Quentin Bell. I am the co-founder and executive director of the Knights and Orchids, headquartered in Selma, Alabama. I wanted to start my section off by telling you a little bit about the work that we do with TKO, and then kind of tie back into how we're responding to the virus, the impact it's having, and some challenges we've been facing. And again, everything we do is pretty much from a client-centered approach. So a little bit about TKO, just to jump into it. We are a Southern-centered grassroots organization. We're founded and led by Black, trans, and queer, gender nonconforming people who are specifically from low-income, rural areas of the state who pretty much had to work for the resources that we've been able to provide. We work very, very closely with the Center for Black Equity. In fact, I am also the chairman for CBE's Transgender Task Force. And that work, what we pretty much do on that end is we work with all of the Black prides across the United States, Paris, and a couple of other areas. And we collaborate with LGBTQ members, again, who are hosting those pride events and who work directly with the folks in our communities to figure out what resources we want to push, what topics, where we're going to play in, and just kind of work within those communities. So I've been blessed, if that's the word. I think I'm looking forward to be able to head to upcoming operations for Center for Black Equity's Transgender Task Force. And what that pretty much ties into what we do with TKO, our mission has always been help where the need is greatest. And in doing so, we try to build the power of our transgender, lesbian, bisexual, queer community, specifically for African Americans. When TKO started in 2012, we were working solely across rural areas of Alabama. And in the last 3 to 4 years, we've been able to move more so to a regional approach, where we're working across the South. And we also have built an amazing wellness network with our partners, Center for Black Equity, Yellowhammer Fund, and some other Black trans-led organizations. And a lot of times I think it's very important that we mention that we are Black-led, because there is a certain amount of disadvantages that we particularly have to overcome, particularly growing up in the South. When it comes to the work TKO does, we focus around basically providing essential support services, services that folks need to survive on a day-to-day basis, the most basic level services, again, where the need is greatest. Some things we've done or the things that we currently do, we provide, help people get access to ID documents, whether it's changing gender markers, birth certificate, those things, but we also focus on health and wellness. TKO is Alabama's only Black trans-led AIDS service organization. We have built the state's only trans and queer-led mobile testing team. We've had recommendations from ADPH's former director of HIV and prevention. And what we've done with our program, which is named Fair Access in Transgender Health, or FAITH, our FAITH program, we started out doing mobile testing, and that pretty much grew to not just looking at sexual health, but overall health and wellness. So now through our FAITH program, we also provide food support. Food insecurity is one of the things that are at the highest for us. And what we do with that food insecurity is just make sure that all people within the rural areas without reach have access to food. We provide job skills and other opportunities. Partnerships with CBE have allowed us to be able to cross-train, to get leadership training for our trans folks, to be able to make sure that there are other opportunities for folks to advance if they're not only interested in working at the grassroots level. So a big part of our work is providing essential support services, but also making sure that we have very, very equitable partnerships. So when we're looking at some of the impacts that COVID-19 or that are actually particularly having on Southerners, we're looking at job loss. A lot of our folks are working in the occupational employees, whether they're in the medical field, they're grocery store workers. A lot of us don't have access to many more career opportunities because of certain obstacles that we face, or certain disparities, economic or social disparities that are just there for trans folks. The same social disparities that we're facing that, lead us to have higher risk for HIV. These are the social determinants that we are facing right now. We're talking about job loss, housing and relocation. For our younger trans folks who are in college right now, they're being forced out and having to relocate. And a lot of them don't have that money saved up to be able to get home. We have isolation because our folks are at 5 times greater risk, have a 5 times greater risk for HIV. Our folks are being forced to isolate, to not have contact for their safety and the safety of the folks in the community. And then for the folks who are rural, you're forced with being isolated with no connectivity. At least some of us have access to internet, and you have access to what's going on. You can stay up to date. You can stay current. You can know what's happening in the media, but a lot of us don't have that. You have access to health care. You have prescriptions that you have, but what happens when your pharmacy, the one pharmacy in your city that will order, your hormone treatment for trans folks, has to close down, or they're not able to keep these items in stock. So these are some of the things that we've noticed in the short time and we've been providing services, and some of the ways that TKO has been able to respond that. So one of the first things we did, before we even got into figuring out that we needed some community first responders, we needed to figure out what folks are needing. What do folks need? What do folks need access to? We need to understand that you can't be without your hormones. We don't know how long this is right out. We don't have to the spread, and people need to be able to have access to the medications while they're in. We want folks to be able to have access to food. A lot of us are losing jobs. We're being isolated, so we can't work. I know a lot of trans folks in Uber who now are being forced to isolation, and that's their sole source of income because the schools have closed. We're talking about work study checks that people are no longer getting. So we have folks who don't have access to basic things like food, like hormones. So we've been able to deploy some temporary staff. We've been training up folks to provide food services. Today alone, we prepared, I think, 100 bags for families. Yesterday, we dropped off 165 families, and these are just the local housing communities where folks are excited and they're happy to see that people are coming out and that they haven't been forgotten, because a lot of times when we specifically say Black, rural Southerners, these are folks who are often overlooked and forgotten. So making sure that these people have access to not only food, but the stores here can't keep toilet tissue. They can't keep cleaning supplies. We've stepped up to be able to provide these supplies to our community folks. At this point, it doesn't matter if you're solely a Black trans person, if you're Black LGBT person, specifically for us, if you're a Black, queer, low-income person, if you're a person who's hungry and you need resources, we're stepping up and providing those resources to folks. And I think it's a great time now. One thing that we have found in this response is that nobody cares if you're Black, if you're trans, if you're whatever, when you're providing resources. And it's just been great to be able to step up and be able to provide that those resources for our community. I think it's also a good time for us to focus on SB 19. In Alabama, we're fighting with the legislation right before the impact, currently always being in a state of caution and high risk. People are having to, we're advising our folks, if you have some extra time, you have a phone, you have access, contact your legislators and let them know that you do want to say no to Senate Bill 219, which could potentially block trans youth who have been prescribed by their doctors, could block their access to the hormone therapy. Not knowing how long something like this could last, people still deserve access to the medications, that they need. So making sure that for us, what we're doing is looking at the basis level, what do people need? And these are some of the things we've been able to provide. We provided, in this week alone, I know close to 3,500 pounds of food. We're packaging everything up. We're training our folks on safety precautions when we're going out, and we're currently waiting on somebody to be able to track if people are showing symptoms, to be able to know how to prepare to go, because these people still have to eat. While we sit back and wait on the test kits, we have to have a plan. So I think one of the major things we have to be worried about is planning. And when it comes to the challenges, some of the challenges we face, plenty of them. For us in Alabama, we're fighting the legislation. We're thinking next steps, like what happens if something like this passes, and the next time, are we going to be ready next time? Showing them that in points like this, how many children could be affected, and I have no idea why they're so excited about targeting just a specific group of folks in Alabama, but we're encouraging folks, if you feel strongly about it, if it's affecting you or folks you know, to reach out to your legislators and let them know. Our reproductive justice, we also partner with Yellowhammer Fund, and Yellowhammer Fund is an amazing collaborator for us. We are the reproductive justice hotspot, which means in Alabama we have a reproductive justice free store. People can come in and get diapers, where families can come in and get tampons and hygiene products. You can get deodorant, along with food, because these are things that families aren't having the extra income to afford, along with contraceptives. We've been handing out Plan B in our food pantry as well. We've had families requesting it because, just being honest, sex is free. And when you quarantine and chill, things happen. You just want to be prepared when those things happen. So we're making sure people have access to the things that they have basically, but also understanding that we can really use some extra support from funders who have it in their hearts to give a little bit more to the rural communities, because our shelves, we can't keep our shelves stocked. Every day we literally had people ride behind us yesterday as we were dropping our food and stop us, like flag us down to get food because they don't have it. So these are some of the challenges that we've been facing here in the South, and these are just a few ways that we've been able to tackle and some of the things that we've been able to do. So I thank y'all for the time.
Thank you so much, Quentin. Now we'll have Tyler Tamir.
Yeah. Thank you. Give me 1 second here. Thank you, everyone, for calling in today. This is obviously a very challenging and unprecedented time for all of us. I currently serve as the CEO of Cascade AIDS Project and Prism Health in Portland, Oregon. This year, we're celebrating our 35th anniversary as a service organization. Like many traditional AIDS service organizations, we were born in the early days of the HIV epidemic. We were tears and terror and cocktails and conversation in someone's living room as a system of social support. And now, 35 years later, we exist as a robust, federally qualified health center lookalike, providing HIV prevention, linkage to care, service navigation, and through the lens of a housing as healthcare model, we're providing a set of housing and other support services to assist people who are living with HIV find stability in their lives, so that then they, in turn, find stability in their healthcare. And then through our Center of Health, known as Prism Health, we provide culturally affirming and compassionate primary care and behavioral health services to the LGBTQ plus community and beyond. We, as an organization in response to COVID-19, have been monitoring, like everyone, the guidance of public health officials on how we best serve and protect our communities. And I think for us, just like all of us, we're trying to strike that appropriate balance between serving and protecting our community, especially as public health and social service organizations. But during this time, we recognize that the populations we serve are often the most vulnerable during a public health crisis, and that many of them are coming to us with a past set of trauma, and trauma specifically as it relates to dignity of care. Because of the urgency in curbing the spread of COVID-19, about a week ago, I made the extremely difficult decision to start to suspend some of our on-site services at our social service locations. We have 3, one located in Portland and then 2 in Washington State, as well as our services at Prism Health, so primary care and behavioral health that's geared towards the LGBTQ community, has begun to transition to predominantly virtual appointments. I think as I frame my discussion today about our response, on a personal note, just want to say that I know that the decisions that we're all making right now mean that for some of the most vulnerable populations we're serving, they're going to feel out of reach, and that some of our clients are going to experience an increased sense of isolation and fear, and that some are going to slip through the cracks and out of care. And that's really hard, I think, for all of us to understand and to strike the appropriate balance. I think it's also important that I quickly acknowledge that our community of long-term HIV survivors often are suffering from post-traumatic stress disorder, and that trauma can be cumulative. And the decisions that we're making right now about asking people to stay in isolation, which is the right decision, may be triggering feelings of fear and abandonment for that community, that those feelings are valid and that they need to be present as we design our new service models moving forward. So I'll start by talking quickly about our health center. Prism Health is a federally qualified health center lookalike, actually only since March 1st of this year. That's very new for us. But we provide primary care, gender care, nurse consultation, and behavioral health to the LGBTQ plus community and beyond. All of those services over the last week have transitioned to virtual appointments, but recognizing the ongoing need of our community to access lab services, whether that's related to their gender care, those that are newly diagnosed with HIV, or for the ongoing needs of sexual health and screening during this time, we're open to the public beginning next week 2 half-days for those lab services. And we're currently looking at how our capacity would look to roll out a drive-up COVID-19 testing location at our health center. We've had a limited number of tests and a limited amount of PPE, which I'm sure a lot of folks are also experiencing. So dependent on how we might be able to roll that out and what access we have to additional measures and tests will determine whether we can move forward with that testing site. Additionally, we offer a set of robust HIV social services, the core of who CAP has been for 35 years. We have moved predominantly to a telework model. So we have about 120 staff across 4 locations, which spans 2 states. And the majority of those staff are now working in a telework model. Our largest scope of work at HIV Social Services has always been in housing and the essential safety net support services that wrap around our clients living with HIV to ensure they find stability. So we're still able to offer our housing and medical case management and navigation services via phone and email. We're working hard to update all of our forms. We've been a paper-centered organization for 3.5 decades, and we're now being forced to figure out what it means to go electronic, at least in this part of our agency. And so we're working on changing our forms to fillable, working on e-sign within the appropriate guidelines of ensuring we get signatures and releases of information from our clients. But the good news is that we're still offering emergency rent assistance. We're getting folks off of our waiting list and into medical motel vouchers in an ongoing way to make sure that they can protect their health and safety. We're looking at ways to offer new intakes over the phone, which has been a bit challenging, but we recognize that right now there's an increased need for emergency rental assistance as folks are losing their jobs or being cut back on hours. Our requests for emergency rental assistance have more than doubled in the last week alone. We're working with the local shelter systems to figure out how we can continue to get folks a space as they implement new social distancing measures, and then maintaining the core services that we know still need to exist, whether we can see our clients face-to-face, ensuring that they're ready for the housing options that we prepare for them through our housing readiness and employment programs, by offering peer support from our staff of folks who are coming from a lived experience, in our case, those living with HIV or who have a past history of mental health or substance use, and that we continue to provide culturally specific HIV service navigation for the Latinx and Black communities of Portland and Southwest Washington. Recognizing that we also serve a wide swath of people who, despite the fact that we can send them a letter via mail, that we can post on social media, that we can have our case managers call, that there is still going to be a subset of our community that are out on the streets, who have nowhere to go, who don't have a phone or an email address, who now can't get into a library to check their email. We're trying to figure out what our on-the-ground efforts will look like and what services are critical for us to be delivering now and what we might be able to ramp up over the next few weeks. Our on-the-ground services at the moment have looked like our agency finding ways to address food insecurity by delivering food boxes to the front door of our clients in need, or for those that we have placed in motels through our medical motel voucher program, reaching out to find out if anyone's having issues with access to their medication and helping to resolve those issues. And then we are still successfully housing folks. Portland has a severe housing crisis, and despite what's happening in the world, our case managers are still actively looking to find places for our clients to live. And we have a commitment, whether COVID-19 is here or not, to ensure that they have cleaning supplies and a welcome package when they arrive, as well as an air mattress for them to sleep on when they get into a housing unit. And all of those services are still up and running on a limited basis from our staff that have opted in to what we're calling the Return to Our Roots movement. We also are still ensuring that our clients have access to bus passes, that if a client comes to us at our door right now when we're not able to offer on-site services, that we can hand them a preloaded mobile phone so they can stay healthy and safe and still get in touch with us if they need to. And finding ways that we can set up socially distanced virtual appointment stations at our locations for clients to come in briefly if they do need to connect with one of the other social service providers or one of our staff in a safe and healthy way. So what has this meant then for the continuity of our operations? We have, unfortunately, are operating under our organization operates in 2 different states, and we're operating under 2 different governors' executive orders, one in Oregon and one in Washington. Unfortunately, they differ quite a bit. There's a lack of definition of what essential services truly are in the Oregon executive order. My fear there is that as a result of not having that definition, there are many businesses and organizations that are still open, and there are still people who are not staying home to stay healthy. And as a result, the police in Portland are required to educate the public about the need to stay home, to stay healthy, but also have the ability to cite folks if they're not in accordance with this order. My fear is that this increases the risk for potential racial profiling or the singling out of communities that are traditionally most vulnerable and furthest from opportunity, which obviously include those experiencing houselessness and members of the LGBTQ+ community. So in response, I've been working closely with the state sheriff's department as well as the local Portland Public Police on coordinating messaging and ensuring how they're training the police force on how to roll out this executive order and how to enforce the citation, as well as talking with our county officials and the mayor's office to ensure that they're all communicating clearly with the public about what essential services are going to remain intact and how we can enforce them appropriately for the safety of our clients. In response, we have created safe passage letters for all of our staff and volunteers that indicate that they're working for an essential service provider and that they're going to be coming and going from our agency as well as out in the community. The executive order does not ask for this, but out of fear of the incongruity of the response to the citation order, we want to make sure that our volunteers and our staff are safe to travel throughout Portland and Southwest Washington at this time. So essentially, outside of our programmatic work, quickly we are just transitioning to new models for both our finance and operations departments. They are maintaining skeleton crews, rotating in and out at least one person on site at a time to maintain the essential services that a finance department needs to do, regardless of whether there's a public health emergency. And we're looking at a whole set of new expenses as an agency as we try and figure out what it means to be predominantly telework. That has included enhancing our firewall to ensure that people have access to our server, which was not at a cheap price. The expansion of virtual technology. We've been using a lot of Zoom appointments to keep our staff connected throughout the week. We've increased to having weekly meetings of our senior leadership team, a quick 30-minute check-in with our management team once a week. And I've increased the amount of time I'm spending with my direct reports to ensure that all of the staff throughout our agency have the appropriate resources to continue to offer services during this time. And then we needed to invest in a new integrated telehealth module, which we were not offering for primary care behavioral health up until now. And we were successfully able to transition all of our primary care and behavioral health over to telehealth in about a 10-day period. We also are looking at ways that we can continue to engage the community, and that has really been making sure that we're communicating as much as possible. That has meant regular updates and info from me to the staff, but also to the community as often as possible in a transparent way about where we're at and what our response has been. And if you're curious about the work that we've been doing, you can visit our website at capnw.org to see our COVID-19 response. Our county health department is being inundated with questions from a variety of communities, and so they've created a series of liaison positions to work with the community, and they have specifically created an LGBTQ liaison to act as a point of contact to answer questions and to get information out to the community, but also to hear what the needs are from the community. And I was asked to serve in that capacity as the CEO of our largest LGBTQ organization in the region. We've launched a community action fund, trying to find low barrier ways for folks to give back to our organization right now. I've seen about 1 million emails from folks doing the same thing, but trying to find innovative ways to do some virtual fundraising right now and really look to our funders for flexibility, to our community foundations for support during this time, and to look to our individual and major donors of the organization to see how they can support us given this time. We did have to make an incredibly difficult decision to move our largest fundraiser of the year later in the calendar year, but that meant it crossed a fiscal year, so we're looking at a large curve of how we can make up some funds in this year to continue providing the essential services that we do provide. So there's a variety of ways that we're doing that by staying connected to our volunteers, donors, clients, and supporters during this time. But recognizing that many of them are hurting as well, we're consistently making sure that we're providing shout outs and support for our local businesses, restaurants, performers, and service industry folks that support us throughout the year, with the thought that if we can support them now while they are struggling at the same time as us, that they will continue to support us in the future. And that messaging has been working really well for us. Finally, just wanted to say that we're hearing a lot about social distance, and just to highlight that there is a difference between social distance and the need for social connection. This webinar is a great example of how we're staying connected as a community, learning from one another, educating each other, learning best practices. But our clients and the communities we serve need that as well. And so whatever we can be doing to make sure that we are staying connected in a virtual way right now to our community is going to be crucially important. And as a Black gay man that has been living with HIV for nearly 16 years and the CEO of an LGBTQ organization, I hope that I can offer some reassurance that the best of humanity that we witnessed in the 1980s is still within all of us. And now we're being called upon once again to demonstrate that. This is why we as organizations and as a community exist, why we approach our work through a trauma-informed and client-centered lens, even in times of crisis, emergency, and uncertainty. And most importantly, we're in this together. The LGBTQ community knows better than anyone how to respond to an epidemic with organized compassion, collective action, and grace. Thanks, everyone.
Thank you so much, Tyler. Just to note, we are going over time. We have some very passionate public health professionals and advocates here, but we can keep on this line and we'll have a few more speakers sticking to 5 minutes maximum. If you're able to stay on, certainly stay and please submit your Q&A. Otherwise, know that you'll receive the slide deck as well as a recording of this webinar later on this week. Now I'd like to welcome Erin Tax.
Erin, you may be on mute.
Erin, you might be on mute. Do you mind unmuting your line? Okay, one more try, Erin. I don't think we can hear you, but we can move on to the next presenter and bring you back in soon. All right, Elizabeth?
Hi, Elizabeth Wagline, and I thank you very much for taking a moment to talk about isolation, risk, and coping strategies. Before the social isolation for the COVID-19, the United States actually did a study back in 2014 to say only 8% of our seniors were feeling social isolation. There are a lot of risks that come into this. So shuttering at home for this virus is really unpredictable, uncontrollable, and has a lot of uncertainties. Fear, anxiety, and depression and stress really come into it. And we need to think about this in a very specific fashion because there's been studies for our community over 50 that will most likely be single and live alone, which then we have no support system. And we're 4 times as likely to have no children. And it creates social isolation and compounds are both physical and mental health concerns. The CDC actually has said that isolation is actually more detrimental than congestive heart failure and cancer combined. So thinking about social isolation is detrimental. So we know we're thinking proactively about what the risks are, but we really need to think, okay, what can we do to help cope? So the next piece is really thinking positively about what your personal strategies may be for resilience. You may have heard in the media that keeping your routines, exercise, eat, sleep, talk to friends and family are extremely important. Isolation, you typically experience sleep deprivation. Even though you're home 24 hours a day and you're isolated, sleep actually gets disruptive. And you need to make sure that you're on regular routines and really structure your time and energy. You do want to make sure that you're engaging, but virtually, because you need to protect your health and well-being. FaceTime, Skype, Zoom, virtual book clubs with your local libraries, watching movies simultaneously with your friends and family, doing virtual dinners, baking, and doing creative hobbies together really help to get you connected. Most importantly, even though you're socially isolated, you need to speak up and reach out to others. Don't just assume the fact that you haven't heard from them that they don't care. They need to hear from you. You need to have personal trust in your own relationship. Listen to their stories, have them talk about their fears and anxieties, and really talk about the COVID-19. It helps to reduce the virus stigma in and of itself. This is a universal experience. We all need to be together in this and trying to think positively that this too will end. But we need to think strategies further to think, okay, Johns Hopkins Department of Psychiatry said, build short-term goals. Don't make big decisions or purchases during this time. When I heard this, I was really surprised. You know, the stress of having to be to be alone in your own home or with your loved one, hopefully a good love partner with you, sharing through this really does create a lot of anxiety. So you need to limit the outlets. Don't watch the news 24/7. Really think creatively and drive your focus into other things. I have here do play brain games. Proactively reach out to the community at large. Think strategies that are good for you, that are appropriate for you and your community around you. We've heard a lot of great groups even today talk about different efforts that are being made. Mindful meditation is one thing. There's been great studies to be able to help people calm and help their stress and reduce that level of anxiety. The stronger we are mentally and physically, the better we have our immune system. There's some apps that are called Calm, Insight Timer, and Headspace. Simple breathing techniques, just breathing in and out, really do help. And I know we've just had the Mr. Rogers movie out recently, but really be kind to yourself and others. And there's another Mr. Rogers piece. Look for the helpers. There's always helpers around you. Reach out to your community. Think really strategically, how can you look out for others and as well as look for yourself. You don't need to be physically in front of someone to care. I was asked to give a little bit of pointers about what we're doing through the Elizabeth County Care Network. We're actually a 63-year-old home care provider. We've been providing care to communities since the 70s and 80s, and we still do it today. And we really need to think the fact that home care provides a delivery system for very simple care to very complex care in the home. We keep the web of our community stable and well. 2019, there was a tipping point where the labor unions in the United States said that we are at a shortage for caregivers. So we have both our caregivers who are workforce and frontline individuals, as well as the people they're caring for persons over 60, at the greatest risk for the COVID-19. Isolation, though it's very stressful, is really the smartest way to protect yourself and others. And I must say it, I've heard it a couple times even today. Please wash your hands with soap and water. I have here 2 seconds, but it is 20 seconds, and a happy birthday really does work. Growing shortages, I just want to talk about a couple quick things. We're talking about really looking at this very strategically. We're working with payers to get labor covered. In the state of Maryland alone, I worked this past weekend to get a new federal approval for Medicaid to pay our loved ones to be able to cover and actually care for them. We need to have backup plans in place. We need to do excellent education and outreach, make sure that people have proper supports and such. And most importantly, stay at home. Do the 14-day self-isolation. It really does make a difference. Telehealth calls, you've heard it earlier. I'm going to say it again. And I just want to say thank you very much for the privilege of talking about innovation and isolation. Thank you.
Thank you so much, Elizabeth. And now we have Aaron Tax.
All right. Thanks so much for including me and for having Sage on this call. First, I'd like to lay a little bit of the foundation of the challenges that we see that this population faces. And unfortunately, these are many issues that we saw even before the COVID-19 epidemic took off. First among them, social isolation. LGBT older people are already more socially isolated than the population at large. One quick anecdote here of someone who visited one of our senior centers in New York. Upon checking in, he was talking to one of our social workers, and she asked him if he had an emergency point of contact she could list on his registration form. And after knowing her for all of a minute or two, he asked if he could list her on the form because he had no one in his life that he could list as an emergency point of contact. And I think the challenges that this person faced exemplify many of the challenges that we see with respect to LGBT older people who are much more socially isolated than population at large. They're twice as likely to be single and 4 times less likely to have children than their heterosexual and cisgender counterparts. So when we talk about staying at home and quarantining as older people, this is all the more difficult when A, you have no one else to be with at home, and when you don't have a family support network in place to check on you. Many LGBT older people are disconnected from families of origin and are instead reliant on what are termed families of choice. Those would be friends and others on whom they rely that they treat like family. And unfortunately, many families of choice are people of the same age cohort who are dealing with the same challenges of having to stay home as they are. And families of choice, as a kind of implies in its name, are people that you don't necessarily even live with. So this creates another challenge of people who are hard to stay connected to when people are forced to stay at home. In addition to that, right now, LGBT older people are unable to access those few places where they once congregated and places where they felt comfortable and welcome and where they could be themselves. Just like at our SAGE senior centers across New York City, those are now unfortunately shut down because of the COVID-19 epidemic. In addition to that, we see a reluctance and fear of seeking care, services, and support by this community. LGBT older people have historically been reluctant to seek these services and supports because of a lifetime of facing stigma and discrimination. In fact, we know that nearly 1/3 of LGBT older people have delayed or foregone needed medical care because of past experiences of discrimination. On top of that, we have this COVID-19 crisis, where we've heard over and over again that older people are an at-risk population. So especially at this time, when seeking care, services, and support is all the more important, older people in particular are struggling because they can't get the services and supports they need. Of course, this is not a time when older people can or should be weathering the crisis alone. It's not a time for the federal government to be turning their back on them, and it's more important than ever that we double down on making sure that this population does not feel invisible. As I mentioned at the top, the COVID-19 epidemic certainly exacerbates the situation. Right now, older people, and particularly LGBT older people, are one of the most at-risk populations. We, generally speaking, have worse physical and mental health than the population at large, elevated rates of chronic health conditions, and higher rates of disability compared to the older adult population in general. In addition to that, 1 in 2 people in this country living with HIV are over the age of 50. And that rate is much higher in places that are particularly impacted by this epidemic, New York City and San Francisco, where that rate is over 70%. At the same time, we see certain politicians saying that older people don't even matter. We have the Lieutenant Governor of Texas saying, let's get back to work, let's get back to living, let's be smart about it, and those who are 70 plus will take care of ourselves, but don't sacrifice the country. And President Trump is at the same time talking about getting back to normal in April and dispensing with social distancing, one of the very few ways we know that we are able to protect older people and other vulnerable populations. So finally, how is SAGE responding to the epidemic? In New York City, really the worst hotspot now for the epidemic, with more than 18,000 cases of COVID-19, a higher per capita infection rate than Italy. SAGE is providing grab-and-go meals to olders who are hungry. We are calling and offering phone-based support to thousands of LGBT older people in need of a caring voice, a kind ear, and a link to desperately needed services. We're offering virtual SAGE Center classes and activities to keep people connected. And we have a national LGBT elder hotline at 877-360-LGBT, which is open 24/7 to provide LGBT older people who might feel isolated with friendly responders and a way to connect people to local resources. So these are some of the things we're doing, and we hope you can reach out to your neighbors and older people in your community to help. Thank you.
Thank you so much, Erin. And now I'd like to welcome Dylan Wagespack.
Thank you. This is Dylan Wagespack. I'm the Public Policy and External Affairs Director for True Colors United. We're a national nonprofit working to end LGBTQ youth homelessness. We are headquartered in New York, although I am out of our Washington, D.C. office. So just for some context going into this, if you don't know, up to around 40% of youth experiencing homelessness are estimated to be LGBTQ+. And there are massive gaps in our system serving youth experiencing homelessness across the board. Those gaps are amplified for LGBTQ+ youth due to discrimination. Right now on the ground, what we're seeing in youth homelessness services on the front lines of the pandemic is that providers are opening their doors, are trying their best to serve youth, often without the necessary means to keep young people and themselves safe. Many have reported not having protective equipment for frontline staff or even cleaning and sanitation supplies. We're also seeing massive understaffing for youth-serving providers right now. That's because there is a surge in young people, obviously, who are indoors during the day, who are not at school. So the daytime staff levels are lower normally than they need to be right now. We're also seeing that lots of staff have children of their own who are at home home, who they have no child care for, and are not able to be at work the same ways that they were before this pandemic. So that's creating some major issues with a lot of our youth-serving providers, many of whom are having to make tough decisions about shutting their doors, ceasing some of their services if they're unable to provide them safely. We are also seeing a potential, I don't want to say it is a sure thing yet, but I'm sorry, my dog is barking, remote work. A potential increase of young people accessing services. There are a couple of likely causes for this. One is that more unsheltered young people are trying to get indoors for safety. We often don't think of young people as the folks that are amongst the unsheltered population, but actually young people are the second highest percentage of the unsheltered population. The other likely cause is the shuttering of college campuses. Many young people do not have somewhere to go once their dorm shuts down. They don't have a family that they can safely return to, and so they are trying to figure things out and potentially accessing these services. So providers are fighting to find spaces for these young people to be able to practice isolation and quarantine in the case that someone gets sick, but they don't have the sufficient capacity. There are some LGBTQ plus specific challenges to this. Like Erin mentioned with older adults, young people are also less likely to try to seek services if they are LGBTQ. That's being exacerbated right now with the news in this past November that the U.S. Department of Health and Human Services is no longer enforcing non-discrimination protections in the runaway and homeless youth programs. However, a message that we want to get out very, very clearly to providers, to young people, and to their advocates in their communities is that it is still illegal to discriminate against LGBTQ plus youth in these programs. And so while there may not be someone on the other line at HHS who is taking those complaints, we absolutely will and can step in to advocate for them should something happen. And so are the local LGBTQ serving organizations. They are also well equipped to step in and advocate for young people. So there's two things that really need to happen in order for us to ensure that all youth are being served right now and that their health is being safeguarded. One is congressional action providing necessary resources for providers to ensure the appropriate and individualized housing solutions for all youth so that they can start to turn the tide on some of the capacity issues that they're facing right now that are really dangerous. The other is coordination between those youth-serving providers and LGBTQ-specific organizations on the ground to ensure that youth are hearing from trusted voices that they should be accessing services that they need and that they'll have an advocate on the outside when they do. Those are really two key critical components that we need to see all young people stay safe and housed through this crisis. And so to that end, and I'm going to keep this fairly brief, but we are working right now federally to advocate for more emergency funding for people experiencing homelessness and those at imminent risk with a specific portion reserved for youth. We had $4 billion included in the package that Congress is working on today. That is between it's around $9 billion less than what we were asking for. So it's not going to be enough to cover the needs that exist right now. Additionally, we're advocating for youth-specific policy interventions, including a cessation of aging out of foster care for at least 6 months, emergency rental assistance specifically for low-income youth and young adults, flexible behavioral health services in shelters and remotely, and more. And one that I'll flag for folks on this webinar today that's really critical is there are many jurisdictions, many states across the country where youth are not allowed to consent to their own housing. To the extent that sometimes that is a policy set by regulation and not legislative statute. It's a really important thing for department like departments of social services or child welfare services to be looking at right now in order to perhaps do emergency regulations to open up that consent for minors so that they can go indoors. We're also connecting with youth and providers to continue to assess their immediate and long-term needs. And we are throwing our weight around as national experts to be able to provide backup to youth advocates and provider advocates on the local and state level. And to that end, I'm going to make sure that my contact information, of course, is shared out with folks on the webinar so that if you do need some assistance or you do need some backup, we can jump in.
Great. Thank you so much. We're going to have Julie Cruza up next, but just a note for all of our attendees, we will not be doing Q&A live. Instead, we'll have collected all of your questions, and we'll send out what our speakers say to them in a follow-up very soon. Thank you.
Thanks, Elena, and thanks for having Family Equality on today. Family Equality is an organization that serves LGBTQ plus people that have children, so LGBTQ plus parents and our families, as well as LGBTQ plus people seeking to form families. And we also work with LGBTQ plus young people who have lived experience in foster care. And one of the primary things we do in concert with many other organizations is to stop discrimination in services. And we have a policy team that works regularly to counter license to discriminate policies permitting service denials to LGBTQ families and youth. And unfortunately, in recent years, over 10 states have passed license to discriminate laws allowing discrimination against LGBTQ plus people in child welfare and family services. Along with some of our other presenters like SAGE and True Colors United, we're suing HHS to stop their notice of non-enforcement of non-discrimination protections because that notice of non-enforcement that went into effect last November does allow discrimination in many older American adult services as well as LGBTQ families and children in foster care. So fortunately, Dylan mentioned that there are laws and regulations prohibiting discrimination against LGBTQ people in runaway and homeless youth services. Those same protections don't extend to foster care and adoption. So we're very concerned because LGBTQ children are overrepresented in foster care and adoption services. So I spoke about the litigation. Trying to keep this quick. What we've heard from LGBTQ families during this epidemic is that families express the same thing that other folks have expressed as laid out on this presentation, that they feel isolated and overwhelmed and need community support and connection to other families, but in an LGBTQ plus affirming way. So while many local communities have programs to keep families connected as they're homebound, Family Equality has started up our neighborhood hub to make sure that there's connections that are available that are LGBTQ plus affirming. And so you can go to our neighborhood hub. We have homebound services through the internet for the whole family, parents, younger kids, teens and young adults that you're at home with, and people who are still working to form their families. And you can find that at familyequality.org/neighborhood. Tomorrow's Drag Queen Story Hour, so that's open for everybody that might need a little mental health break. We also have a COVID-19 Advocacy Action Center focused on the needs of LGBTQ families and foster youth and alumni. So you can always go and visit that. But what I do urge those of you who are advocates is to make sure that any continuing COVID-19 response legislation does not provide any waivers to non-discrimination policies. And again, because some human services are no longer protected under federal law, it would be great to even have non-discrimination protections in or explicit LGBTQ plus inclusion in recovery services. And In terms of LGBTQ foster youth and alumni, I would just note that the recovery legislation to date has provided very, very little funding to enhance services. And Dylan pointed this out in his presentation, that young people who have aged out of foster care and, for example, lose their student housing are told to go home, but there are many alumni of foster care that don't have biological or adoptive families to go home to, especially LGBTQ foster youth who are overrepresented in the population that have aged out of care. So we need increased services to those youth, but out of over $2 trillion in federal funding, only $43 million has been targeted at helping the child welfare system and alumni of foster care. So we encourage you in helping advocate for that. And our Advocacy Action Center is at action.familyequality.org/COVID-19. And that's it.
Thank you so much, Julie. We'll wrap up here. If you have any questions, and any of the questions that we've received in our Q&A box, we will receive them for the next few weeks and compile a Google Doc that our speakers will be able to respond to, and we'll send it out to you all. Also, if you want to be added to our listservs, again, my email is here, elena@healthlgbt.org. Thank you so much for your participation, and we look forward to engaging with you further in the future. Have a good day.